The first on the list of things that people can take in order to improve egg quality or sperm quality is L-carnitine. L-carnitine is present in various foods, in particular in red meats. But again, it's going to be very hard to get sufficient levels of L-carnitine to improve egg quality and sperm quality unless you're going to take it in supplement form. The typical recommendation, based on peer-reviewed studies that have shown significant improvements in egg quality, that is chromosomal arrangements, that is the likelihood of fertility or pregnancy rather, the likelihood of sperm being forward fast swimmers as opposed to twitchers or immotile and having proper morphology, all those measures has been demonstrated to be significantly improved by the ingestion of L-carnitine. How much L-carnitine? Well, that depends on how you're obtaining the L-carnitine. If you're obtaining it in capsule form, 1 to 3 grams per day of capsule form L-carnitine is what's been suggested to improve egg quality and sperm quality. Now, 1 to 3 grams per day can be taken all at once or spread out throughout the 24-hour cycle. It can be taken with or without food. It does not seem to matter. And when taken for a period of 30 to 60 days, does seem to significantly improve all the parameters that have been discussed for egg quality and sperm quality. Now, the mechanism for that effect is pretty clear. L-carnitine is involved in the processing of lipids, fats, in terms of mitochondrial function. And as we talked about before, mitochondria are vital for the organization and action of the spindle that pulls apart the chromosomes, taking that cell within the female from diploid to haploid, which is essential. You really want just the 23 individual chromosomal strands. You don't want chromosomal repeats. It's also involved in the actual fusion of the egg as it exits the ovary and enters the ovulation cycle. Mitochondria are also important, as we talked about before, for the forward motility of sperm because of the enrichment of mitochondria in that mid-region just behind the head that cause the whipping flagellation of the tail, allowing for forward movement, as well as other aspects of cellular morphology. So it makes a lot of sense as to why L-carnitine supplementation would be beneficial. Again, it's 1 to 3 grams per day over a period of about 30 to 60 months. If you're hoping to conceive in the upcoming months, recommend taking it for at least 30 days prior to that. Of course, based on the data we talked about before, the cumulative probability, fecundability, et cetera, there's no reason to not continue to try for pregnancy before taking L-carnitine. But L-carnitine is going to improve egg and sperm quality. And so you might actually take the stance that even if you don't have any problem getting pregnant, wouldn't you want to maximize the quality of the egg that gets fertilized and the quality of the sperm that fertilizes that egg? So that's additional rationale for taking L-carnitine. One important note, if you are going to take L-carnitine in oral form, in capsule form, it can increase something called TMAO. TMAO can cause stiffening of the arteries. You don't want TMAO levels to go too high. One way to offset the increases in TMAO caused by oral L-carnitine is to take 600 milligrams of garlic per day. I suppose you could eat cloves of garlic. That would work just as well because garlic contains something called allicin, which can offset the increase in TMAO. But 600 milligram capsules of garlic are going to be, or garlic extract rather, is going to be the most probably cost-effective and simplest way to do this. And also they are going to create that garlic smell. Some people like the smell of garlic, some people don't. So if you're going to take oral L-carnitine, I suggest also taking 600 milligrams a day of garlic extract. And you can do that at any time throughout the day. It doesn't have to be with the L-carnitine. The next item on the list of compounds that have been shown to improve egg quality and sperm quality, and quite robustly so, is coenzyme Q10. Coenzyme Q10 is something that you can actually measure levels of in your blood. Most physicians will say that they want to see your levels of coenzyme Q10 to be somewhere between 0.5 and 2.5. It's going to depend on the units. Most people, I realize, are not going to run off and get their CoQ10 measured. It's not included in most standard blood tests, but if you were to measure your CoQ10, that's the range that you want to look for. That said, many people opt to supplement with CoQ10, and you'll find that many fertility docs, OBGYNs, and urologists that are trying to assist their male patients with fertility will suggest CoQ10 because, again, it supports the health of mitochondria. Mitochondria are so vital to so many aspects of the formation and fertilization of the egg and sperm that, of course, fertilizes the egg. The coenzyme Q10 dosages that are most often suggested and that you'll observe in the peer-reviewed research literature on humans, I should add, is 100 to 400 milligrams per day. And the coenzyme Q10 is taken generally with a meal and ideally a meal that contains fat. And there's even some idea that taking coenzyme Q10 with your dinner, assuming that dinner includes some fat, you don't have to add additional fat, is going to be more advantageous than taking coenzyme Q10 early in the day, although that's probably a detail that's getting a little too far down in the weeds. So again, 100 to 400 milligrams of coenzyme Q10 per day, whether or not you're a man or a woman, for improving the likelihood of fertility by way of improving egg and sperm quality. And again, if you're somebody who just doesn't have any problem getting pregnant, or if you're already producing many sperm of quality morphology, this is another case in which you could take a step back and just say, well, why wouldn't I want to further optimize the quality of the egg and the sperm? Because the quality of the egg and the sperm ultimately are going to determine not just whether or not you have a successful pregnancy, but are going to determine, admittedly in ways that will forever remain cryptic to you, but nonetheless are going to be important in determining the qualities of the brain tissue and body tissue of your offspring. The third item on the list of compounds which are commonly suggested or prescribed by fertility docs nowadays for men and women wishing to conceive and or optimize their fertility as a basis for general vitality and health is inositol. Now, inositol has many uses. So you'll hear about the use of inositol for reducing anxiety or improving mood or even for the treatment of depression. We talked about inositol in previous episodes of this podcast. For instance, I talked about inositol and in particular taking 900 milligrams of myo-inositol prior to sleep, which is something that I do along with the other supplements that I take and recommend for sleep, such as magnesium threonate, apigenin, and theanine. If you're curious about those, you can see our newsletter on sleep or our Perfect Your Sleep episode or the Master Your Sleep episode. It talks about behavioral and supplementation-based tools for improving sleep. But myo-inositol is not just suggested for or prescribed for people that are wishing to get pregnant and for general health, but myo-inositol is often recommended for people that want to improve egg and sperm quality because of the way that it can positively impact insulin sensitivity. Insulin sensitivity might sound like a bad thing to people out there, but it turns out that you want to be insulin sensitive. The last thing you want is to be insulin insensitive. Insulin insensitivity is associated with type 2 diabetes, with obesity, and even for people who are not challenged with obesity, you want your cells to be insulin sensitive. You don't want a lot of insulin floating around in your system with your cells unable to use that insulin. That's really what insulin insensitivity is about. Myo-inositol at dosages of 1 to 5 grams per day. It's pretty high, 1 to 5 grams per day, keeping in mind that 1,000 milligrams is 1 gram, has been suggested to improve egg quality and sperm quality. Now, one point of, I wouldn't say caution, but of note is that myo-inositol can reduce anxiety and it can be a slight sedative, which is why some folks, including myself, take almost a gram, 900 milligrams prior to sleep. If you're going to take 5 grams of myo-inositol, you would want to restrict that to the late evening or second half of your day. And I don't suggest starting that high. I would start with 1 or 2 grams and then working your way up, seeing what you can tolerate in terms of the level of anti-anxiety and drowsiness that it produces. 1 to 5 grams per day of myo-inositol is what's suggested for both men and women wishing to improve egg health and sperm health. But for women, it's also often suggested to include also, to take myo-inositol, but to also take D-chiroinositol. D-chiroinositol has elements in it that can be both pro and anti-androgenic. Androgens are things like testosterone and related molecules. There are a number of different causes of infertility and disruption to egg quality, age being the most significant factor. But another significant and very common factor, even among young women who are of fertile age, is having too many androgens, and as it relates to something called polycystic ovarian syndrome. We'll do an entire episode about menopause and PCOS and a number of other things that relate to fertility because it's an entire and very interesting other discussion that we need to have. But the recommendation is that women take 1 to 5 grams of myo-inositol, but also D-chiroinositol because of the ways that it can balance androgens and offset some of the negative effects of polycystic ovarian syndrome, or even for women who do not have polycystic ovarian syndrome, because of the ways that D-chiroinositol can balance androgens in ways that are beneficial. The dosages of D-chiroinositol that are recommended tend to be 1/25th to 1/40th of the myo-inositol dose. So you have to get out your calculator. Remember, 1,000 milligrams equals 1 gram. So figure out if you're taking 1 gram of myo-inositol per day or 2 grams, you're going to want to convert that to milligrams. So let's say you're taking 2 grams of